You know, when we think about getting straight teeth, our minds usually jump straight to one thing, braces. But today, we're going to dive into a totally different way of thinking about it, an approach that's less about the metal and more about the incredible muscles that actually shape our smiles from day one.
For most of us, braces are just a rite of passage, right? It's just something kids go through. But what if we've been looking at it all wrong? What if crooked teeth aren't the real problem, but just a symptom of something deeper? So to really get to the bottom of that, we have to start by questioning everything we thought we knew about why teeth get crooked in the first place.
The story we're all told is that it's just genetic bad luck. You know, you got your mom's small jaw and your dad's big teeth, and they just don't fit. So the solution is to wait, and then later in life, you just mechanically force them into line. But what modern science is telling us is that's not the whole picture, not even close. All right, so if it's not just a roll of the genetic dice, then what is it? Let's pull back the curtain and look at the real hidden factors that are actually shaping our faces and jaws as we grow. A huge piece of the puzzle is something called orofacial myofunctional disorders. I know, it's a mouthful, but what it really boils down to is this. The muscles in and around your mouth, your lips, your cheeks, and especially your tongue aren't working the way they're supposed to. And that little imbalance has a massive impact on how a kid's face and jaw develop.
And check this out, because this is probably the single most important habit of all, where your tongue rests. On the left, you see what's really common. The tongue is sitting low, pushing against the teeth. But on the right, that's the goal. The tongue is resting up high, flat against the roof of the mouth, right on a little area called the spot. When it's up there, it acts like a perfect, natural expander, shaping the upper jaw so it grows wide enough for all the teeth to fit. It's a game changer. Okay, so that wrong tongue posture we just saw, it doesn't happen in a vacuum. It's usually part of a team of bad habits. The three big ones are breathing through your mouth instead of your nose, swallowing incorrectly by thrusting your tongue forward, and of course that improper resting posture for your lips and tongue. And hey, don't just take my word for it. This is not some new idea. This quote is from Dr. Edward Hartley Engel. He's literally called the father of modern orthodontics, and he said this over 100 years ago. He called mouth breathing the single most powerful cause of crooked teeth. Think about it. When your mouth is open to breathe, your tongue has to drop, your lips are apart, and the whole growth pattern of your face just gets thrown off course.
So if the problem is actually about muscle habits, then the solution can't just be about moving teeth around, can it? This realization leads to a whole new way of thinking.
And the philosophy behind this new way is just beautifully simple. Treat the causes of crooked teeth. That's it. Instead of waiting for the house to be crooked and then trying to jack it up, you focus on making sure the foundation is laid correctly from the very beginning. This slide just lays it out so clearly. On one hand, you have the traditional way. Wait and see, then use mechanical force, which often means pulling teeth to make room, and then you're stuck with permanent retainers for life to stop it all from moving back. But on the other hand, you have the myofunctional approach. Get in there early, correct the habits, let the body's own growth potential do the work, and the goal is a naturally stable smile that doesn't need to be held in place forever. Okay, so that's the theory. But what does this actually look like in the real world? How do you train muscles? Let's get into it.
Well, one of the most popular systems for this is called Myobrace, and it breaks the whole process down into 4 clear stages. First things first, you have to tackle the root cause with habit correction. Then you work on creating enough room with arch development. After that comes dental alignment, and finally, retention, which is all about making sure those good new habits become permanent.
Now, a big part of the toolkit is a removable appliance, kind of like this one. But it's not like braces. It's not using brute force. It's more like a coach or a trainer. It gently guides the tongue to stay in the right spot and encourages you to breathe through your nose. And the best part, the wear time is usually just an hour or 2 during the day, plus overnight while you sleep. But, and this is so important, the appliance is only half the battle. It is not a magic fix. The other, equally crucial part is a set of daily exercises or trainer activities that actively retrain and strengthen those oral muscles. And here's a perfect example of what one of those exercises looks like. This is teaching a correct swallow. You learn to put your tongue tip on the spot, close your lips, and then swallow by pressing your whole tongue flat against the roof of your mouth without using your cheek or lip muscles. You're reprogramming the thousands of swallows you do every day to work for your development, not against it. Now, I know what you're thinking, especially if you're a parent. This all sounds amazing in theory, but will my kid actually do this? It's a fair question, so let's look at the reality of patient cooperation. I mean, let's be real. Braces are glued on. There's no choice. But this approach, it lives and dies by the commitment of the patient and their parents to wear the appliance and do those exercises every day. So how does that actually work out? Well, a recent study actually looked at exactly that.
And when it came to wearing the appliance, the results were pretty mixed. You can see here the biggest group, almost half, only wore it at night. And only about a quarter of patients actually managed to wear it both day and night, like they were supposed to. It just goes to show you perfect compliance is a huge challenge.
And it's not like kids are just being difficult. There are some very real reasons for this. The same study found the number one complaint from a whopping 42% of kids was gagging. General discomfort and irritation were right up there too. These are real hurdles you have to overcome.
But, and this is the number that I think is the most hopeful and telling of all, despite the gagging, despite the discomfort, a massive majority, 87% of patients understood the mission. They knew that wearing the appliance correctly could help them avoid much bigger deals like braces or even surgery down the road. They got the why.
So it all leaves you with this one big question. For a century, we've focused on the metal wires and the brackets. But what if the true secret to a naturally straight, healthy, and stable smile isn't in the hardware at all, but in the simple, powerful habits we can build every single day?